Hello everyone, my name is Nishant Shah and I'm a preventive cardiologist here at Duke University and the Duke Clinical Research Institute. I also had the pleasure of being one of the principal investigators for the REVEAL study, or the real-world exploration of ASCVD, of evidence-based management of atherogenic lipoproteins. The REVEAL study is one of the first studies of the CardioHealth Alliance that looked across 5 health systems within our alliance to better understand how we are doing in managing LDL cholesterol in patients with established cardiovascular disease. So LDL cholesterol, like many of you may know, is a very atherogenic lipoprotein. What that means is that high uncontrolled levels can lead to cholesterol buildup within the blood vessels of our body. And we have clear guidelines that really tell us, based on good evidence, on how low we need to make that LDL cholesterol to avoid that buildup of blockage or an event like a heart attack or stroke. There's a lot of gaps, however, between what the guidelines are asking us to do and what's actually happening in the real world. And so the REVEAL study really helped across our Cardio Alliance to see how we as a society are managing LDL cholesterol in real world practice. And what we found across 200,000 people, that LDL control, at least at the guideline level, was very suboptimal. Only 40% of patients with established cardiovascular disease were found to have guideline-based LDL-C levels. That left 60% of people untreated, who are at high risk because they already have established atherosclerotic disease. Furthermore, we found a lot of disparities. We found that women and underrepresented minorities were more likely to have uncontrolled LDL-C. We also looked to see whether or not we are testing people for a very sticky cholesterol called lipoprotein A. Lipoprotein A is genetically mediated and can cause early onset atherosclerotic disease in a very aggressive fashion. Testing for it can be very helpful in assessing one's risk. So we looked across our alliance health systems to see how many patients with established cardiovascular disease actually had lipoprotein A tested. And we found that only 0.4% of over 500,000 patients had a lipoprotein A test. And we found some benefit associated with lipoprotein A testing. Those that did get tested, though it was a small number, were more likely to have intensification of cholesterol-lowering therapy, especially non-statin therapies, such as PCSK9 inhibitors and ezetimibe. However, there were also disparities in those who were likely to be tested versus those who were not. Those who were not tested were also more likely to be women and of underrepresented minorities. What the REVEAL study shows us is that there are a lot of gaps in care, and there's a lot of work that needs to be done. And as a CardioHealth Alliance, our goal is to do that work.